Part of this obviously is about looking forward, but what's being built into this plan about going back? Like, if we don't hit the specific criteria, could there be parts of the plan that move forward and others remain? Or is step one, step two, and they all go in conjunction together based on that criteria?
I see it, and it's not just my plan. Obviously, there's been a lot of us who've been talking and thinking through this in the last few weeks and months, and it is a plan to go forward. We may need to slow down how we go forward depending on what happens, and we've had challenges where there's been more transmissible viruses, strains that have been circulating, but we are confident that we will continue to be able to move forward. And that's why we said earliest possible dates. We need to have a period of time of measuring. So we have some criteria. We're reducing some of the restrictions that have been most restrictive in a number of different areas. And then we need to watch and make sure that we're not seeing concerning signs or concerning outbreaks, clusters happen. But we have to remember as well that this is based on basic public health work that we do all the time. So it's going back to the place where we have enough people protected that public health can manage clusters and outbreak as they arise, like we do for many other communicable diseases. So there will be some things that will never change. Things like staying away from others if you're ill, taking those extra measures like wearing masks in those circumstances where we're in close contact with others, particularly right now where we still have a lot of unknowns, cleaning our hands regularly, and making sure that public health has the capacity to monitor cases and contacts over time. So those are the things that will allow us to keep moving forward. Yes, there are things that we can't plan for that may mean we need to slow things down, but I don't see a situation where we're going backwards unless things change very dramatically. So I guess I never say never, but the plan is to keep moving forward, but we may need to slow down.
Just with respect to Richard's first question about the pace with which we'll move with the restart plan, I want to put some context on where we are here in British Columbia. We've just passed the May long weekend. We're days away from June, weeks away from July. And there have been some in the community who have said, we need to know right now where we're going and how we're going to get there. And then there's a whole bunch of other people, the overwhelming majority, who have been saying, how can we safely continue to hang together, as Minister Dix said, as Dr. Henry has said, for months and months and months. And we put together this plan across government on the advice of public health, on the advice of the Ministry of Health in terms of capacity in our healthcare, our acute care system. And we're confident that we are in a positive place to put in these steps forward in a measured way based on data. And I just want to reinforce that for British Columbians. There are going to be a lot of people who are anxious. I would suspect that Vaughn's question speaks to that there are people who are concerned that we may go too fast. And we've tried to balance throughout this ordeal, how can we best represent people's needs at a government level, within the economy, within our healthcare system. And we are very confident that we have waited to the appropriate time to lay out a 4-step plan to get us back to where we all want to be. I'm very confident that if there is anything we've learned from COVID-19, it's to expect the unexpected. And Dr. Henry and her team are watching every minute of every day, international events here in British Columbia, to make sure we're as advised as we possibly can be about the risks. And then it falls to us as government to weigh those risks, to engage with the public. Minister Kahlon's industry engagement team, there's some 70 different organizations from business to labor, community groups, not-for-profits, Indigenous groups, who come together every week or two to hash these things out, to make sure that we're going in a measured way so that we can have a positive outcome. Going forward and then slamming back again is not what we want to do. We've seen that in other jurisdictions. We're confident that Dr. Henry has given us the map. Vaccinations, as Minister Dix has said, is our key to success. If you haven't registered, go do so today.